All right, good morning, everyone. Thursday, March 27th, a little after 9:30. We're going to start picking up some work on H-233, an act relating to the requirements for state-funded grants. For those of you who've been following along for more than this session, this is a piece of policy we heavily discussed last biennium. And we're just continuing work on this topic. So today we're going to take some testimony, but first we're going to do a walkthrough on the bill with council. Good morning, council.
Good morning. 2 days in a row.
Loving it.
You don't have me at all.
And now we're just like
You get enough.
consuming you with all of your being.
Oh, man. All right. Rick Sagel, Office of Legislative Counsel. So H-233, the chair is correct that this bill, I forget, was it 140, H-140 last session, last biennia. It passed out of this committee and it went to appropriations, and they were not comfortable with the potential implications for the grant requirements. So I'll kind of walk through the bill. It's very similar to what passed out of the GovOps committee last year. And I know there's been some talk about amendments. I'm not quite ready to go over those. I think after you take testimony here from the those who want to amend the bill, and then you can kind of tell me what you want to do, might be the best way to proceed on this. So H-233, starting on page 2, this is all going to be session law because we don't really have a lot of statutory guidance on grants. A lot of this is going to involve Administrative Bulletin number 5, which is the policy for grant issuance and monitoring. So you'll see that kind of throughout the bill. Okay, section 1 directs the Secretary of Administration on or before July 1st, 2025 to include a uniform formula and approval process for use in all state-funded grants for nonprofit corporations to use an indirect rate higher than the standard de minimis rate pursuant to federal law. And I can't speak to the intent, behind this, but these bulletins are issued for state guidance, and this is what agencies would use. But you can also direct the agencies to include something in their bulletins. And if you want to have them produce this, that is your call. Section 2 is about prompt execution of grant agreements and prompt payment of grant funds. Subsection A, a state agency shall execute a state-funded grant agreement with an organization not later than 30 days after either funds are appropriated in the budget for the agency or to the agency for the purposes of a grant agreement, or notice, either written or verbal, of an award of a state-funded grant is provided. So testimony last year indicated that there are times where a state agency gets the grant funds or gets notice that a grant has been awarded and there is a delay. I'm not sure what the average time is for these grants to be awarded to the agency, to the organization, but I think there is an issue, and this would require that the state agency that gets the grant funds executed not later than 30 days after they either have appropriated the funds in the budget or notice is given to the state agency. 2, if a granting agency is unable to do this, basically not do it within 30 days, they shall submit in writing an explanation to the agency administration as to why it was unable to meet its obligation. So we're kind of softening the requirement a little bit as to, if there's some kind of legitimate purpose as to why they couldn't do it in time. They just have to let the AOA know why they couldn't do it. Okay, subsection B is similar, except instead of executing the grant, it's paying on the grant. For all executed state-funded grant agreements, the granting agency shall pay the grantee within 30 days after receipt of a valid written request for payment from the grantee. And a request for payment from the grantee is valid if it meets the requirements in the executed grant agreement between the two. So similar, I think, issue where a organization has these expenses, submits their receipts for reimbursement to the agency, and it takes a while. You'll probably hear testimony on how that looks and the problems that come up with that. This would require payment within 30 days. However, subdivision 2, similar exception that if they can't do it, they shall submit in writing to the AOA as to why it was unable to meet its obligation. Okay, subsection C, reporting. The AOA shall create an online form where its grantees, that are awarded grant funds are able to provide notice that a granting agency did not timely A, execute a state-funded grant agreement pursuant to A1, or B, pay the grantee upon receiving a valid written request for payment pursuant to subdivision B1 of the section. So again, we're giving the organizations ways to kind of let the AOA know that there are problems, right, with various agencies, that we're not getting paid on time, we're not getting our grant agreements executed on time. 2, create a publicly accessible a database on its website that displays all non-confidential information submitted by grantees. So allowing the public to see, are these grants actually getting funded and how far back are we, those kind of things. D, just requests the AOA to update their bulletin with this language. Section 3, a working group, which again was in the last bill. We have changed it a little bit in this bill. There is a working group created to assess the current state grant awarding procedures. The membership of the group is the Secretary of Administration or designee, 1 representative of Common Good Vermont, 2 representatives, each of different nonprofits selected by the Director of Common Good Vermont, who have received a state funding grant within the last 12 months, 1 member of the House, 1 member of the Senate, and 1 representative of Department of Finance and Management appointed by the governor. So they should begin meeting on September 1st of this year. Pretty standard language here. I'll let you read that on your own. Powers and duties, subsection D. They shall assess the state's current grant and contracting funding levels and determine whether the state should review the cost of living or other inflationary adjustments on a regular basis. Assess, due to delayed reimbursement, how the need to obtain bridge loans and lines of credit have impacted nonprofits and their ability to provide services to the state. 3, assess the grant and contracting processes of the Agency of Human Services to identify best practices and areas need improvement. 4, determine how to increase the number of state funding grants, recommend solutions to improve reimbursement practices and processes of state funding grants, identify system improvements that would simplify the process, examine ways to ensure consistency between state and federal and direct rates, including reviewing the process for nonprofits to qualify for an indirect rate above the standard rate and honoring federal indirect rates. And then 8 and 9 are both analyzing how delayed execution and delayed payment are affecting these grants. 10, consider related issues that arise during the course of the working group's duties. Working group has assistance of JFO and AOA. They shall submit a report to this committee and the Senate committee September 1 of next year. And then you have the standard per diem language and the expiration of the working group December of 2026.
Representative Hoover.
Okay,
Okay, hello.
so back in the 30-day notice period, it's like get started 30 days passes, the Secretary of Administration gets notified, and then the process drops off basically. So I've got a renewal cycle if it goes longer than 60 days.
Are you asking what currently happens, or are you asking what the bill would do? So assume with the grant agreement being awarded, so the bill would require, with an exception, right, that the agency that receives the notice of the grant award or the funds in the budget, they would be required in that 30-day window to alert the organization that is going to receive the grant funds, and then execute that agreement within 30 days. And if they don't, then they have to tell the AOA why they couldn't do it.
Yeah, then that's the point where.
Yeah. Then
Then supervision of agency stops? I mean, what
Uh,
if it takes 90 days? Who knows?
yeah, I think that's what's currently what's happening, right? That you have these delayed execution of grants and the bill does not really. H-140 last year did not have that carve out. So here we have a carve out and yeah, if it goes on 60, 90 days, it would be publicly posted on their website, right? That this is taking a long time, but there wouldn't be really any, right?
Mr. Chairman, there's no stick.
Say again?
There's no stick.
This is the conversations we're having right now as we take testimony. This is the walkthrough part of discussion and other testimony, will ensue, but point taken. Anything else for council from the table? Nope. All right. Yeah, I mean, for most of us, it's reasonably known subject matter. So those of you who aren't here, don't be shy about questions. All right, council, thank you. Next up, Emma, how are you?
Morning, and thank you for having us in today and taking up H233. For the record, my name is Emma Paradise. I'm the manager of policy and strategic initiatives at Common Good Vermont. And Common Good Vermont is a statewide program of United Way of Northwest Vermont. And we're dedicated to uniting, strengthening, and advocating for Vermont's nonprofit sector. And I know you've heard from me already, so I just wanted to take a few minutes to hear directly, before you hear directly from nonprofit witnesses, to remind you why this bill is so important, especially at this time. So nonprofits providing services on behalf of the state rely on state government grants and contracts. And oftentimes these funds do not cover the true cost of services. And system processes create additional challenges for organizations. Currently, it's virtually unheard of for organizations to receive an indirect rate that's higher than the standard 15%, regardless of what their overhead costs are associated with the services being provided. One organization did the work to work with a consultant and calculate what that would be for them. It was closer to 30%, but the state agencies wouldn't honor this, even though they have the ability to. So H233 would create a standardized methodology to calculate indirect costs, establishing a pathway to appropriately and fairly accounting for costs. Delayed payments, as you heard, and delayed contract execution are some of the most frequently cited challenges with our current grant system. Some organizations, including one that didn't receive a contract for 5 months after it was supposed to be in place and did not get paid for 3 to 5 months after the month close. So that's a big delay. H233 would track these, which is a good start to understanding where the processes are breaking down. But agreed, there is no stick in this current version of the bill. Tracking this and providing a pathway for nonprofits to report challenges would be a first step. The bill would also create a working group to improve our state grant system and processes, including around timely payments and grant execution, to reduce processes, administrative burden, ensure fair funding levels, and also very importantly, mitigating the consequences of reimbursement agreements, which really exasperate these challenges as organizations have to cover costs out of their own pockets and then may not be reimbursed for months out from that. And so this is really an opportunity to explore solutions, such as those that came out of a similar task force that was established by the Oregon legislature in 2023. They came up with solutions including uniform application processes, reporting requirements that are commensurate with funding levels, and standard contracting language that permits flexibility in contract terms and conditions. And I'm happy to share that report. And organizations are not in a position to abandon their missions or deny services and care to those that they serve. But the current system puts their work at risk. They are losing time and money on contracts that do not cover their costs and take significant staff time to manage, which is not billable for them and for the state. And we've seen organizations who've had to shut down programs, close completely, or opted not to renew state contracts because it wasn't viable. And many of these organizations also receive federal funding, some of which they've already lost that funding and others are at risk of losing it. For Vermont nonprofits who participated in our 2024 wages and benefits survey, 53% report receiving federal funding, which on average was 27% of their budget. And then 72% receive state funding, which on average was about 33% of their budget. At the same time, those that are serving our most vulnerable populations, providing food, shelter, and healthcare, will likely see demand for their services rise as cuts to food assistance, Section 8 housing vouchers, and Medicaid are felt. In this moment, we really must strengthen government nonprofit partnerships to ensure that we can continue to provide essential services to Vermonters with greater efficiency and effectiveness. Organizations come to the table with solutions and are ready to collaborate with regional planning commissions, municipalities, legislators, and the administration to modernize our state grant system. And so that's all I have, but happy to answer any questions or.
Any questions from the table? Representative Larson.
Thank you. Do you have any idea, as far as the late payments are concerned, do you have any idea what percentage are late versus paid in a timely way? Is it like most of them, or?
I think it really, a lot of organizations have multiple grants. So in some cases that may be, half of their grants are late, but it really varies between agencies, between the grant, between the timing. I think we see a lot more delays at the July 1 start date than for other funding cycles. But the majority of organizations that I've talked to have reported that it is a challenge, at least with some of their grants.
Anything else? Thanks, Emma.
Thanks, y'all. Appreciate it.
All right, next up, Daniel Franklin.
Good morning.
How you doing?
First of all, I just want to express my gratitude to be here and also for all of your service. And one of the messages that I want to share today is, how difficult your decisions are when so many people are in need, and in particular in light of what's happening at the federal level. And it's a no-win scenario. You can't make everybody happy. And I just want to appreciate all your service and the hard decisions that you have to make. My name is Daniel Franklin. I'm the executive director of the Vermont Association for Mental Health and Addiction Recovery, which is an 85-year-old organization that, among other things, advocates for the mental health and addiction recovery community and trains the peer workforce and many other things. Prior to that, I was the director of Jenna's Promise and was there for the first 5 years of that organization's emergence. And then I was the director of North Central Vermont Recovery Center for 4.5 years. So I've been in the nonprofit world for quite some time. VAMHAR, where I currently work, doesn't have any state grants currently as of last February, but all of the previous nonprofits that I worked at did have substantial state funding. So I'm coming to you from a couple of perspectives. I have watched the slippery slope in which the sort of dysfunction and issues that are illuminated in this bill have cascaded across the health and human service system. And while nonprofits encompass a great many types of nonprofits of various sizes, from the giants to your mom and pop shops, at the end of the day, many face the same issues, which is that delayed payments can have incredibly big consequences for the organizations, for their survival, for their ability to pay payroll, for their ability to grow. If you don't feel secure in your finances, you can't build and grow and plan for the future. You can't build reserves that create economic resilience. I think it's really important to understand that we have just survived. We've survived COVID, and it was catastrophic, especially in the health and human service system. We have survived the floods, which was catastrophic in its own right. And now we have what's happening at the federal level. And I was a part of a conversation with a lot of executive directors convened by Common Good Vermont, in which we discussed, and the reality is that we're not going to be able to save all nonprofits and all for-profit entities. Many are going to go under. Many are going to have to look at mergers and acquisitions and fiscal agent agreements and many other things. What we have to look at now is how do we prevent systemic collapse? We are already seeing it in the mental health and substance use community. I can illuminate a few of those things, but I'm sure you can read them in the paper, but it goes far deeper than that. And, just on the personal front, I'll say that when these things happen, it costs lives. Since 2010, 1,820 people have died of opioid overdoses, several thousand from alcohol use disorders, 100 from alcohol-related car crashes, hundreds and hundreds and hundreds of other, uncounted issues. So when substance use and mental health providers can't do their work, it cascades. So I'll tell you a couple of stories. You heard the 5-month story. My previous employer and organization at Jim's Promise, we were lucky to survive. Last May, we were down to 1.5 weeks of payroll. We were owed almost $500,000 in grant money. They did not give us our grant until basically month 11. We were spoon-fed lots and lots of reasons. It started with basically after the legislative session, lawyers going on vacation after the session. That went on for a couple of months. It's noteworthy that there are different fiscal years that are in play here, whether it's federal fiscal years, organizational fiscal years, and the state fiscal year. So that can have an effect. But ultimately, I would say on average, in all the time that I've been an executive director, most of the grants that are due to come in July are coming in mostly in September, October, optimistically, but I've seen more common than that in January or February. Of course, I'm interacting with only a portion of the system, which is the Agency of Human Services. They are facing their own issues, right? They have staffing issues. Last year, we lobbied or advocated for example, the Department of Substance Use Services to get additional staff time there after the retirement of their previous director, Cindy Seavright. We saw this sort of cascading issue at DSU in which they were unable to process things. But what I hope to illuminate is that a very small issue can cascade into a multi-month long process. So let's say, we get a spreadsheet, right, that we submit for reimbursement. And if it's 1 penny off, if there's a rounding error, the net, and then they have to take time to review it, right? So they find your error, then they kick it back to you. You fix the error, you resubmit it through some online system or an email address, which you receive no response to let you know whether they got it. Then the net 30 restarts. And then you have to submit another request for them to expedite it if you have low cash flow. So there's, these incredibly, like a 1 cent rounding error can cause a multi-month delay in processing. To kind of get to the point, and I'll just try to be succinct here. I fully support H.233. I'm really thankful for some of the provisions. It is a little bit toothless in a certain respect. And really, it's not like we want to hold our state partners to account, and it's not their fault, per se. It's just we have to create better systems. One of the other corollary issues, and I'm glad that it was enumerated here in Part D too, is that when these monies are delayed, nonprofits, and I've been through this many, many times, they have to apply for lines of credit through commercial banks, and they're using state grants as collateral. You have to actually provide information about your state grants, so they're holding that information on the prospect that you are going to be paid. That becomes especially tricky when you don't know what the federal government is going to do and if they're going to suddenly take away money that you have just used as collateral. So one of my suggestions would be to create an internal state mechanism to either blend prospective and reimbursement-based grants, or to create internal state-based lines of credit where the state itself is securing the funding and providing nonprofits with bridge funding to survive in cases of emergencies. As far as, and this directly links to the indirect rate, the reality is most, and the 15% just became the federal, allowable rate unless you go through a very extensive process of getting some higher rate. The reality is most are still operating under a 10% indirect rate. How this is linked is that the administrative burdens of administering state grants at all levels of the audit processes of all of the things that are involved in having state or federal dollars are increasing. Often the indirect money is money that you hope that is going to be left after the direct service that you're providing to handle the administrative costs and possibly to build that safe reserve in case something goes wrong. Now, between COVID, the floods, the federal issues, and these late payments, we have kind of this compounding issue where very few nonprofits have a healthy reserve of money, which general standard is about 3 months of reserve money. Most could not survive 3 months without getting paid. And if you don't have a wealthy benefactor, you're in trouble. Like that is what I did last May, was when we were not paid for 11 months. And we were spoon fed all these reasons of why our grants weren't being executed. I went to my biggest funders and I said, okay, I know you were going to give me $100,000, or I think you're going to support me in November. Can you move up your timeline to support us earlier on? So we were able to just get under the wire with some of that funding to be able to survive things like that. And so this bill is a great step in the right direction. Again, I just want to reiterate, like, right now, we need the state's help and we need it expeditiously to move toward a healthier ecosystem for nonprofits. It's a highly fragile, highly extractive system. We rely on our nonprofits. They are the lifeblood of our economy and our communities, 20% of the workforce, a huge part of our labor economy and basically, some of them, they just aren't going to survive this. How do we not lose the arts, which have been hemorrhaging businesses very quickly? Health and Human Services, we are losing beds daily because people can't afford it. We just lost treatment beds. There's corollaries in every part of that system. So, and the consequences essentially of your work is life or death for some people. So I just want to, again, thank you for this. We're all in on this bill and to help convene partners. And, I know that there are 2 partners that would be at the table, but I would just ask you vehemently when it comes to legislation in general, that I would implore you to talk to people who are on the ground, who we often fill these studies and these legislative panels and things like that with state level designees who are far removed from the realities of our daily life. And those of us who live on the front lines and are experiencing on a daily basis, and you are citizens too. You all are you experience it when you go to the grocery store. We're all in the same boat. But when you fill these studies and extend them for 18 months, it can have dire consequences. So thank you for your time. And any questions?
I'm actually just because
Gonna come.
the flock is gonna work with folks who are back here and ask members of the board questions on two. So, thank you very much. Next, please, Olivia Sharp.
Hi, good morning. My name is Olivia Sharrow, for the record. I'm the executive director of Vermont's Free and Referral Clinics. My organization is a small nonprofit association that supports the 8 healthcare clinics across Vermont that provide free services. This includes medical, dental, and mental health, as well as support services such as insurance navigation, case management, and free prescriptions. Our member clinics also provide resources such as food, warm socks, blankets, and more to their patients. The Free and Referral Clinic Network served over 13,000 patients in 2024. Patients coming to these clinics experience some of the greatest barriers to accessing care. These can include lack of sufficient health insurance, lack of housing, food insecurity, limited English proficiency, low incomes, limited access to transportation, and many of our patients arrive having delayed care due to cost or access. Our members are truly free clinics. They're funded through grants, individual giving, and in-kind donations. Our largest grant, which I manage, is a legislative appropriation that is overseen by the Department of Health. This grant accounts for between 20% and 85% of individual clinics' budgets, and it makes up 95% of the association's budget. I'm here today to ask you to support Bill H-233 because it would directly address some significant challenges that my organization and our members experience granting with the state of Vermont. Late payments, which you've already heard about, have presented a huge problem for us. As of today, March 27th, we are 8 weeks past our second quarter invoice submission. Because our payments are reimbursement based, this means that we spent the money sometime between October 1st and December 31st and will only be reimbursed at some point in late March, exact date still unknown. In the third quarter of fiscal year 24, our payment again came almost 7 weeks after I submitted our invoice. By the time it arrived in the third week of June, our bank account had dipped to about $5,000, which for context is a few weeks payroll. This situation happens when expenses in the current quarter are higher than in the previous quarter because our payments are reimbursement based. None of our grants carry over from one year to the next, so we are always fully expending everything by the end of the year. This precarious situation is compounded by the 7 or 8 weeks it takes for our payments to arrive, and that's become the norm. Since the funding that my organization receives is distributed to our member clinics, they're obviously also impacted by these delays, waiting 7 or 8 weeks for payments to cover expenses incurred delivering healthcare services to patients. As I shared earlier, for each clinic, this Department of Health grant makes up a significant portion of each clinic's budget. In the words of the executive director of the Open Door Clinic, our member in Middlebury, this is a quote: "It is hard to manage cash flow with these increasingly unpredictable turnaround times, and any accompanying communication about why or when is virtually and consistently non-existent. For safety net organizations serving 13,000 patients per year, this is unreasonable from our single largest source of grant income." End quote. In addition to late payments, we also consistently receive our grant agreements about 4 months after the fiscal year has started. Last year and the year before both came in mid-November, which means we're operating and incurring expenses without a formal written contract from the state. Bill H-233 includes the formation of a working group to better understand these challenges and others, including the feasibility of prospective payments versus these reimbursements. This is a critically important task. In the words of the executive director of People's Health and Wellness Clinic, our member in Berry City, "All of our state grants are retrospective. As a small nonprofit providing free healthcare, our monthly expenses are stable and predictable, but our cash flow is not. While we consistently meet our budget, delays in state grant payments, sometimes by weeks, create significant cash flow challenges. The lack of clear communication from state officials about when we can expect the payments for services already provided makes it difficult to plan for both routine expenses and larger necessary purchases." End quote. We also believe including a review of funding levels and cost of living adjustments to be an important task of the working group. While we understand and of course support the state's need to be sustainable, level funding is itself unsustainable for the state's nonprofits. From fiscal year 18 to 22, our Department of Health grant was level funded, despite our patient numbers increasing significantly and both inflation and COVID putting significant pressures on our budgets. It's important to understand that while we're all affected by these problems, they disproportionately impact small nonprofits like mine with limited fundraising capacity and no investments. By not addressing these challenges, our state is maintaining a broken system that hits the smallest organizations the hardest. I also want to be clear, this is not a people problem. This crosses agencies and it's not tied to individual grant managers. What we're all sharing today are a series of system and process issues. These are uncertain times. Half of our funding is federal, and our Department of Health grant is connected to the state's Medicaid plan. So things that happen to Medicaid affect the free clinic network. It can sometimes feel like there isn't much that we have control over. And a nod to what Daniel Franklin was saying, I imagine that it is challenging for legislators too, to know that really what all of us need is more money and to know that that's just not an option. But we bring Bill H-233 to you as something that you can do. It improves and introduces accountability into a system that we all, including the free clinics and our 13,000 patients, rely on. For these reasons, I asked you to support Bill H-233. Thank you.
Thank you very much, Olivia.
Yep.
Russell Bradbury, Carlin.
Hello, everyone. Thank you for considering this bill and giving us the opportunity to speak to it. I'm the Russell Bradbury Carlin, the Executive Director of Interaction. Interaction is a nonprofit agency based in Brattleboro and Bellows Falls that, among other things, offers services for runaway and homeless youth and separately offers restorative justice programs to youth and adults. I've worked in the human service world for almost 3 decades. And over that time, I've seen the needs from the various communities I've worked in increase quite significantly. The work itself has become more complex. The types of folks that we're working with have multiple issues and need more than often one service or one person to help them move forward. And systems that we interact with have also become more complex, which is part of the reason why we're here today. In response to all of this, I've always been looking for ways to be more efficient. Always asking, what is the shortest distance between the resources we need to do the work and the people who we serve by our work? I strongly, strongly believe that H-233 is a great start to eliminating issues that are inefficient for us as well as for the state, and in some cases greatly impede the work we are being paid to perform, as you're hearing already from folks today. So I'm going to focus in on as a lot of us are, on the timeline things, and this overlaps into some of the stuff the working committee would be addressing. I could give you examples and about almost anything that are being brought up here, but I'm just going to focus in on on that late payments and late contracts, because it is the one that I appreciate that it's being put forward as something that can happen now while the working committee is working on the bigger issues. So as you all know, or maybe you don't know, it was only a few years ago that a lot of our state grants were paid up front, or we had enough of those that were paid up front. And it's been over the last few years that they've become reimbursable. State contracts reflect about 55% of Interaction's budget. So what that means in a practical level is, as a nonprofit, we are required to have about 50% of our monthly budget in the bank unencumbered. Like most nonprofits, we don't have that amount to draw from. I know the 3 months. I've never worked in a nonprofit that had 3 months of cash sitting in the bank waiting to be drawn from. I would love to meet someone and to hear how they actually got to that point. But we are fortunate to have a line of credit with the bank, and I've heard that there are other examples of that happening. A lot of small nonprofits aren't able to provide enough collateral in order to get a line of credit. And we're fortunate that we're large enough and we're able to secure that. We run a lean and efficient agency fiscally. But due to the changes in these funding processes that have been described today and other issues, cost of living increases and so forth, there have been times where we've been hundreds of thousands of dollars deep in our line of credit. We pay interest on this. And when we are reimbursed within we pay when we even if we get paid in 30 days, we pay interest on that. But when anything goes beyond that, we pay additional months of interest on the money we wait for. The same dynamic occurs when our current grants are recontracted in a new fiscal year, and we have to wait months for the contract to be finalized. We continue to pay our staff to do the work without being able to be reimbursed, or in that time anyway. We estimated that in 2024, we spent approximately $35,000 in interest on reimbursable contracts. That's almost a staff person. That's a lot of money that we don't get. We have to fundraise. We have to find other resources for. So it's a really significant hit for us. What I appreciate about this bill is that it takes some immediate action. This is what I was saying earlier, that repairs some of the more harmful issues that negatively impact agencies like mine. But the proposal to create a working group feels like the most important piece. There are numerous important issues that this group would discuss, this committee would discuss, and make recommendations on. Tackling these, I believe, will have the greatest impact on the work we do over time. We love the work that we do at Interaction in our community on behalf of the state. It is very important work that I know much of our region values greatly. These changes would allow us, and I suspect the state departments who administer the grants, to operate more efficiently and allow us to continue to use tax dollars for what it was really intended for. Thank you.
Thank you. Ben, how are you? Nope. There we go.
Thank you. My name is Ken Schatz. I'm the interim CEO at Lund. I really appreciate the opportunity to testify this morning. And I will say that Tim Keefe, the Chief Financial Officer for Lund, is also here with me. And my intention is to actually be brief, because frankly, the other witnesses have covered much of the same territory that I would have stated. And so I'll fairly quickly turn it over to Tim to provide you with a little bit more detail. But we to be clear, we're coming at this in support of H.233. We do believe that there are challenges for nonprofits that this bill would address in a significant way. I will share with you, for some of you who don't know me, in a prior life, I was the commissioner of the Department for Children and Families. So I have some experience in the past looking at this from the perspective of the state. And so frankly, am mindful of some of the challenges and issues that state actors have in terms of providing prompt responses and dealing with the financial aspects of providing grants to nonprofits. I will say that from both perspectives, I think it's critical, as other witnesses have already indicated, to recognize that we have a system in Vermont that really relies on nonprofits to provide essential critical services. So that it is relevant to make sure that we have a system that really works well. And there definitely are challenges. Lund, as many of you know, provides an array of services and programs intended to support children and families to enable them to thrive. We provide services statewide in the areas of adoption. We're a parent-child center, and we also have a significant clinical treatment program, including a residential program for moms and young kids who have, where the moms have substance abuse and/or mental health issues. We're unique in the sense that we actually have in a residential program the children up to age 5 living with moms, so that we really can provide a holistic family approach. So we are really proud of our programs. We work with actually 4 departments in the Agency of Human Services, so we have experience with an array of different divisions of that agency. I will say, and Tim will talk more specifically, we have definitely had challenges with respect to delays. For the most part, our interactions with those state agencies have been responsive. People are trying to make the system work, but they do have challenges that do impact us. Now, having listened to some of the other testimony even this morning, it's also worth mentioning Lund, as Vermont nonprofits go in the human services space, is relatively large. We have an $11 million budget. We actually do have a reserve. So that in fact, when we have had some of these difficulties with respect to timing of payments, we have had cash flow challenges, but we've been able to address it. But we're definitely cognizant that that's not necessarily the situation that smaller nonprofits find themselves in. And so for that reason, we really do support the bill and some of the efforts made. I also want to repeat that we also agree that the working group is really a critical portion of this proposal. That is, I do believe the state agency folks want to make the system work effectively. And if we sit down together, maybe we can try to come up with some ideas and solutions collaboratively that can help make this system more efficient. So I'm going to stop there because I'm going to turn it over to Tim to provide you with a little bit more detail. I will say that I also want to let you know that I apologize, but I have another meeting at 11 a.m. that I have to attend, but that if there are questions, we are in communication with Emma from Common Good, and we can definitely follow up as needed. So thank you for your attention. Really do appreciate you taking up this bill and listening to us today. Thank you.
Thanks. Yep. All right. And our last guest today, Tim.
Hi there. Thanks for having us today. My name is Tim Keefe. For the record, I'm the Chief Financial Officer of Lund, and I've been in this role for almost 6 years now. And Ken mentioned that we are fortunate that we have built reserves, cash reserves, but I can tell you that when I arrived here 6 years ago, that wasn't the case. And I've spent probably the first 3 months on this job sweating every other week, figuring out whether we'd be able to make payroll. So I know what that's like. And we've been able to build reserves largely through fundraising. And that's really helped us the last year or so. We pulled together a sheet, I think, which we already entered in to the record that sort of summarizes our association with the state, and I'll go through that briefly. We have 9 grants and 3 contracts that account for roughly 70% of Lund's revenue. And with regard to the renewal of contracts, last summer we experienced very significant delays in the reissuance of grants, ranging anywhere from 70 to 155 days. One of the contracts that was late in getting signed was our residential treatment contract, which we bill anywhere from $250,000 to $300,000 a month under. So as you can imagine, beginning in July, without a signed contract, we were providing those services without the ability to collect. The contract wasn't signed until October, and by that point, we were $750,000 behind on collections for that program, which again, context is about a month and a half worth of our payroll. So that's where the reserves really bailed us out, because we borrowed at least that much from our reserves during that time period. So that's, I will say our experience once we have the grants in place, our experience in collecting payments has been good. For the most part, we do collect everything within 30 days, except in that instance with the contract not being executed. We certainly support looking at the indirect rate. Our indirect rate is in the high teens. Certainly much higher than the 10% de minimis rate that most of our grants and contracts still have. I guess those are the highlights that I can give you from our perspective. But as Ken said, if you have any questions, I'd be happy to answer them.
Yes. All right, questions? Yes, Representative Hoover.
Ken, question for you because of your experience in state government. How much, if any, of this is due to federal pass-through getting plugged up in our administrative process or even delays at the federal level?
Well, I want to be clear that my experience, I was commissioner through into 2020, so it has been several years. But your point is well taken, that is one of the challenges for state agency people. Sometimes is their own difficulties in receiving money from the federal government. In the case of Lund, a significant portion of our funding is actually federal funding that comes through the state. So that's definitely a factor here that needs to be considered, and to the extent we can address it.
Anything else from the table? All right. No, thank you, everyone. This is just really like the opening of this conversation. We plan on taking a lot more testimony on this and dedicating a significant amount of time to this bill. So I appreciate everyone's presence today and input. And we're definitely gonna keep this ball rolling. But with that, time to slide over to a flood of amendments. See what I did there? All right.
So funny.
Let's take us off for a couple of minutes so we can wait for everybody to get settled and